Good evening. I'm Julia Hastie from Roseland Road Therapy Centre, and my part on the team is to speak about the body-mind connection when we're referring to chronic disease and how to manage the care, not just of our patients, but also of the carer and the caretakers, the family members who are looking after people with health challenges, and how to keep them in great health, and how our bodies and minds affect each other. Over the last 3 weeks, I've spoken about the brain in more detail than perhaps some people know. We spoke about the head brain and how we use our sense of sight to take in a lot of information and process it using the head brain. But we also have a heart brain, and the heart brain relates to our connection to others around us and gives us a sense of feeling and connection, and a lot of information comes in through the heart brain. And of course, we have the gut brain, and the gut brain is that sense of knowing that gives information back to the heart and the head brain. And if we can follow our head and our heart and our gut, we will be able to take good care of ourselves and also make good decisions. Now, I related the head brain to the sense of sight and using the sense of sight to take information, with the heart brain, using the sense of smell to really develop that emotional brain, and that was on a different YouTube. And the gut brain, we learned an exercise where we learn to really listen to our environment and what's going on around us. And today I want to talk about the fourth sense, which is the sense of touch. And the sense of touch is an incredibly important way of getting information in to all three of the brains about the body. Now, if you think of a child who has fallen or is feeling unwell, the first thing that we all naturally know how to do is to take our hands and touch. Touch where on the knee or the shoulder or the head, where the little one got hurt. So the sense of touch is extremely natural and useful. We all know how to do it, and we do it. Even if you think of Dr. Nawazi, when she examines a patient, she won't just use her eyes and her ears. She will literally use her hands to touch the person and get a lot of information back. But you don't need to be a medical doctor only to do some level of care through the sense of touch. Now, I would like to introduce the concept of tapping. And when I say tapping, I mean moving one's hand like this. So let's go back a step. Imagine you have a sore shoulder and you told somebody, maybe Dr. Mawazi or your next door neighbor, and when you were telling them the story, you would put your hand on your shoulder. That's a natural, intuitive thing to do. Your brain would immediately turn its attention to that shoulder and say, but oh, there's something happening on the shoulder, isn't it? That's how our brains work. So we can use that thing of getting attention from the brain to a part of our body to help us. And we're going to use tapping to give it extra attention. What do I mean? So this week we're talking about osteoarthritis in specific. So osteoarthritis relates to pain in the knee or the thumb or the hands or the hip. And just because it's easier to show on a video, I'm going to focus, say your thumb has got this pain or a shoulder. With one hand, you're going to touch it. We want your brain to think, what's going there? Hold that thumb. Hold another person's thumb. With your other hand, you're going to tap. And I'll show you how. Tap lightly over the head brain. We want that head brain to say, brain, extra focus on that elbow or knee or whichever is painful. A few times like this. At the same time, nice deep breathing. When we breathe, we help the brain get extra information about what's going on in the body. Now we keep our hand on the hurt part and we tap over the heart brain. And we're saying head brain, heart brain, pay attention to this hurt area, this painful knee, this painful shoulder. Nice deep breath so that oxygen-rich blood is going to the brain and the heart. And now we're going to tap over the gut, over the tummy. And we're still holding that hurt part, so the brains, all three of the brains are going to be saying, what is going on in that area? And your brain is made to have a look and say, is there a little bit of infection there? Has it been hurt? Is it feeling strained? Is it cold? And now you've got all three brains kicking in to head brain, heart brain, gut brain, to focus its attention on a place that is hurt. Now, when I first learned this technique, people said, this is too good to be true, it's way too simple. But no, really, what we're doing is that brain's ability to pay attention to what is going on in the body, that's all we're trying to maximize. Now, when I teach people this tapping technique, they ask questions about how hard should I tap and how long should I tap? And here's the part where you're going to use your hands to get good information to make that decision. Some people like a firm touch, and they'll tell you, oh, if I go for a massage, I want the person to use their elbow and use a very firm pressure. And for some other people, that is terrifying. That sounds like pain. What they want is a very light, soft touch. How will we know the difference? Well, if you're able to ask the person, or if you know yourself, you can get that information. But most often we can't ask if it's a child or a frail person who doesn't know. Well, your hands will give you the information, isn't it? And your eyes will give you information. If you are truly connected and you put your hand here, you'll feel this shoulder, this body likes quite firm pressure. I'm going to hold it very firmly. Or when I do a firm pressure, this body feels nervous. And then we're going to make a lighter pressure. This finger is maybe feeling the effects of the arthritis. I was at an older lady today, and I was working on her hand. And when I got to this fourth finger, she suddenly became stiff. And that tells me, but there's pain. She's not able to speak. There's pain and inflammation there. And immediately, when I was working on this fourth finger, I used a much softer touch. So our eyes will show us the reaction of the person, and our hands will tell you, is there this or is there this? And even a very young child will give you that feedback. You're holding on the shoulders or the back or the knee of a young child, and they like a firm pressure, you'll find they lean in like this. They want it, they need it. And many children these days need a very firm pressure when you're working with them. But this is for your own sake. And so you've got this finger, and now you're going to say, okay, but I need to tap, but now I must hold my finger, but I must. So what we remember, the point of the exercise is to focus the brain. We're going to hold this joint that is giving me pain. My eyes are focused on it. All my attention is focused. My hand is focused on it. And if you must, you can let go. Head brain, focus on the pain. Heart brain, focus on the pain. Gut brain, focus on the pain. We'll go through it again. Head brain, heart brain, and gut brain. And the whole time we're doing this, we're doing nice deep breaths. So if the image goes from my brain is here somewhere worrying about things, and my hand is over here somewhere else, that's a very disconnected feeling. Now we want to take all the brains in the body, the breath that's taking in information and circulating, getting our blood feeling strong, and really paying attention to that one hurt area. Say your jaw is very tight. Maybe that's part of your headache. Maybe you have one of these headaches. We're going to focus one hand on the injured part. Head brain, heart brain, light brain, gut brain. The hand that's focusing on the painful area, you will feel, does it need a firm touch or a light touch? The tapping hand doesn't have to be very intense. imagine you can't use your hand. What we're saying to the brain is, brain, pay attention. Brain, pay attention. Brain, pay attention. So your brain probably doesn't need to be hit and to be hit hard. Brain, pay attention to my headache. Brain, yoo-hoo, pay attention. Heart, brain, pay attention. Gut, brain, pay attention. Ideally, if your hand is spread and over both halves of the brain, we're going to incorporate both the brains. But remember, the strength in this is that our brain is always trying to update the information it has and is taking in. This is not something you would only do once off. This is something you can do 10 times a day. And every time you do, and you're saying brain, heart, brain, gut, brain, have a look at the shoulder. You're updating it just like a computer would update. Just like you would take a piece of work and say, well, this information is where it was yesterday. Let's look at the information again. It's you're the newspaper of your own body. We want to update what the brain is seeing going on in an area and improve it with all three brains. Is there a question?
No, Julia, thank you.
I would invite you to try it. I would invite you to get in the habit. Now, remember, we spoke a few weeks ago of becoming still once a day, feeling into tensions in the head, skull, neck, and body, and becoming aware, is that jaw tight? And we first just gave it attention to say, oh, I didn't even realize I'm holding my teeth like this, or my shoulders are like this. Then we spoke about doing nice deep breath to get more circulation and going in the area, but maybe one needs a little bit more. And I was saying, brain, go and pay attention to what's going on in there. The reason I go on so much about the brain is that it's the information processing center of what's going on in your body. How your body was this morning when you woke up is not the same as when you were eating your lunch. It's not the same when you're exercising. All your levels change throughout the day. When you're doing Tongi's exercises, the way your body uses oxygen is completely different. The way your brain is directing blood flow to different areas completely changes all the time. So saying to your brain once, hey, pay attention to my shoulder, and leaving it to that is maybe not going to be enough. Now we're saying to your shoulder, you know what? We're going to take information in over and over again. A very interesting extra use of this technique is for someone who's in shock. Now, if you've had a shock, if you've just had very bad news, you've just been stung by a bee, you've just tripped and fallen, what happens is the breathing tends to become very short like that. And the mind feels a little bit scrambled, isn't it? I know, especially falling, it's very upsetting. You think, how could that happen? Why didn't I look? Why didn't they turn on the lights? There's load shedding and I didn't see the box and so on. So the brain feels and the mind feels very scrambled. And that's part of what makes it difficult for the body to become settled again after a shock. The most potent technique you can do is find that area that's in pain and shock. And if it's your head, hold on to your head. And you're going to focus and say, head brain, heart brain, and gut brain. And see if you can really get those three focused and synchronized and working together to take information in and information out and get it coordinated. Some people like to have an image in their mind when they're doing this. If you'd like to imagine a rainbow between these two brains down to this brain, that's wonderful. Or sparkles or sparks of electricity, if that helps you focus your brain more, you're very welcome to do that. I think children often come up with very innovative ways of doing it. Or if you truly want to stick with your sense of touch, because we know how much information we get from that. Is this body, is this brain loving that touch? Does it want something firm? Does it want me to be soft? Does it want me to go a little bit back? You'd be amazed at the amount of information your hands will give you about your own body or somebody else's if you ask it. So I'm Julia. That is an introduction to something called the cortices technique. I didn't make it up. The cortices means the brain cortices. There are PDFs, there are many YouTubes, there are lots of more information about it, and I'd be very happy to share it. But for now, let's integrate the sense of sight, smelling and breathing, listening, and now touch, focusing that brain onto the area that it needs. Thank you. Unless there are more questions.
Hi, Julia. The thought that comes to my mind is love your body. And that's kind of like what you're teaching. You're teaching us to love our body in various ways. And love meaning caring for our bodies, and bringing our brain to the attention of where the pain is or whatever it may be. And all the other exercises, it's wonderful. I just want to thank you for your contribution. It's been awesome.
Thank you. I never thought of it like that it is a loving and caring of the body, and maybe also listening. And the real magic of it is that all the things we're talking about are completely natural to us. Our brains are built to take care of ourselves. Our bodies are built to give us the best way forward. And sometimes it becomes overwhelmed or hurt. And then we stop and, as you say, give it care, give it attention, give it focus, and it will do its work. And this technique can be applied to a tiny baby who's crying, and right up into an elderly person, a very fragile person. The important part is to use that sense of touch to get the feedback, and use that sense of touch to direct the three brains.
Is that it? Is that it? I mean, it's a mouthful, and it's a lot.
It is.
May I just give the other two, Thongi and Dr. Nolwazi, maybe an opportunity to say something?
Yes. Yeah, Julia, actually, when you're talking about this, I mean, I always say you are what you eat. Obviously, you end up said after you've eaten whatever it is that you've eaten, you need to listen to your body. So I think it's same as you say, pay attention to your body, you know. It's vital. And I like the fact that you are so right that the brain indeed will work if you give it a time. Sit and listen to your body. It will communicate to you, and it will be through the brain. Thank you.
Very much so. And maybe that introduces another way of using this technique. Sort of a form of shock can also be, say you did exercises with Tongi, but you overdid it a little bit, and you stretched yourself, or you fell while you were doing it. That's a kind of shock. Again, sit, take that hip. I went hiking on Sunday. My legs are still so sore I can hardly walk. Take those hands. These hands are connected to your brain. Put your hands on them, and we focus. Head brain, heart brain, gut brain. Imagine the power of using all your own brain power on your own body. And it's a very effective thing, and it requires nothing more than your hand. And sometimes people ask left or right hand. It doesn't matter. If for some other reason it's uncomfortable or painful to touch, you can go over the head and just lightly on the hair. It doesn't matter. We're saying to the brain, pay attention.
Wow, I must say one thing for sure, Julia, that we are going to do it. My wife and I, we've got this recording now, and I think it's time for us to move over to that. We're going to give it a try. So ask us next week, okay?
Can I give one more way that it can be used? It's a fantastic way to prepare for something because you're getting your brains organized. So say now you're going to sit down and there's a Zoom and you're worried that you're going to struggle to concentrate. Sit in front of your computer, take some nice deep breaths, head brain, heart brain, bring you into order. Or you're going to do an exercise with Tongi and you're worried because you know you've got a fragile area. Before you give it exercise, brain, pay attention to the shoulder. I've had children do this before exams or reading tests where there's a lot of anxiety and they know when they're anxious, they read badly or that they struggle to concentrate on homework. Well, okay, let's prepare the brain. Put your book there. Brain, we're going to do reading now. Head brain, heart brain, gut brain. There is more detail to the technique that we can introduce later. And maybe in the last minute, I'll slip in one little thing. And that is, remember in week 2, we talked about the limbic brain, the emotional brain. You could include that and say, I'm going to hold over my limbic brain, this emotional brain on the side. Emotional brain and head brain, emotional brain and heart brain, emotional brain and gut brain. Let's get all of them synchronized, organized, communicating with each other. Memory and emotion, thinking, feeling, picking up. Now we've got a very connected little group. Now that little child doesn't need to be scared to go into the classroom. Now your body, Tongi, can face that piece of food that you're going to offer it without being afraid.
Wow.
Very powerful technique.
Wow.
Yeah.
Julia, may I suggest something? I just want to switch on my camera. In one of your talks a couple of weeks ago, you mentioned, with the smell, the sense of smell, and memory improvement, and I'm sort of getting on, so I forget words and things like that. And I thought to myself, maybe this is going to help me. And I just want to show you here. I've got a little dish.
Yeah.
There you can see some stuff that I picked out this morning. I got leaves from a lemon tree. I've got some lemon grass in here, and I've got coriander, and I've even got some so and I started doing it, and I do it every day. And I've also got a friend of ours gave me a lot of whole bunch of these oils, essential oils.
Oh, nice.
So I've got them like arranged here in front of me, and every now and again during the day, I'll just pick up a bottle and just sniff on it. And I must tell you, there's something is changing. Something is changing. I'm not sure what it is, but it's good.
Yeah.
And I even think my memory is getting stronger. I believe it is.
Amen. Isn't it wonderful? Yeah, amen.
Yes.
Here is the thing. Here is the computer. We give it good information and it will get to work.
Yes. And the sense of smell is, I read up on it and I did a study on it. Apparently, I mean, our sense of smell is the most advanced sensory piece of equipment of the body. I mean, it even takes and processes more information than what the eyes process. That's incredible.
Yeah.
Yeah, that's incredible. And so where's all that information going? It must be doing something. It definitely calms me down. I must tell you that.
Oh, 100%.
Yes.
Yeah. I went to visit a stroke patient today and I took 3 bottles of oil, and she gets tired and overwhelmed easily. So I'd do some work with her and then do 3 lime, orange, and lemon. Do some work, lime, orange, lemon, just to settle the emotions, keep the brain going, but without any hard work.
Yes, thank you very much. Thank you very much, Julia.
Thank you.
We've still got 2 minutes. Dr. Nolwazi, we still haven't heard from you, my dear. Would you like to comment?
Okay, thank you so much, Julia. It's so interesting that indeed the body is designed to heal itself. So like you said, let's take good care of our bodies by eating healthy and exercising, avoiding smoking, avoiding too much use of alcohol, and of course, also getting enough sleep, you know? And like you said, let's listen to our body. If you feel something is not right, seek help. Thank you. That's all I'm going to share with you today. Thank you.
Thank you. And yes, they are not two different systems. My son fell very badly one day off his bicycle, and he was bleeding. It was clear he needed stitches. I didn't not take him to the hospital, but I was tapping his brains while his father was getting his things ready, while we put a compress on the injury, and while we were at the hospital getting the stitching. I was tapping all the way to keep him out of shock so his body could accommodate it. So absolutely, it's not two different systems. Help the brain, use what we're doing.
There we go. Wow, well done.
Thank you. Thank you.
Okay, thank you everybody for being here tonight and for the contributions so far. A special thank you to you, Julia. That was awesome. I enjoyed it very much, and I'm sure so did the others as well.
Yes.
And I'm growing in this process as well, and I'm excited about it. And let's say goodbye to everybody. Bye-bye.
Goodbye.
Bye.
Goodbye.
Bye.
Bye-bye. Bye all.
Bye. Bye. Let me stop the recording.